You have a headache, a real skull thumper. So you shuffle across the valley to the smartest person you know. The local healer looks at you and makes a very common diagnosis for the ancient world. Headache? Seizures? Acting strange lately? There is a bad spirit trapped in your head. To get it out, they plan to install a physical door. They are going to drill a hole straight through your living skull. This procedure is called trepanation, and human beings were doing it tens of thousands of years before anyone invented soap or the wheel. In their world, this was the smartest, safest, most evidence-based choice available. You can find the physical evidence almost anywhere you dig. Early surgeons were opening heads in North Africa, Ukraine, Portugal, the Americas, and China. The numbers are staggering. In certain prehistoric regions, between 5 and 10% of recovered skulls carry the unmistakable signature of a hole drilled by another human being. This shows exactly what that looks like. You are looking at a perfectly smooth, circular window cut directly into the crown of a human skull. Finding thousands of these heads forces a massive question. How does a man with a sharp rock crack open your skull and leave you well enough to walk away? Picture the operating room. There are no clipboards, no sterile fields, and absolutely no anesthesia. Just you, completely conscious, holding as still as you can in the dirt. The surgeon had options. Package 1 was slow and steady, carefully scraping at the exact same spot, layer by layer, grinding through the bone until the membrane of the brain was exposed. Package 2 was the groove and pop, scoring a clean circle into the skull, cutting deeper with every pass, until a tiny disc of bone could be lifted out like a lid. Package 3 was drilling a tightly packed ring of small holes, then chiseling away the remaining bridges until the whole piece came free. These distinct, refined techniques show us that early surgeons were practicing a calculated craft. Their tools were remarkably effective. The glassy black volcanic rock known as obsidian can be flaked to an edge finer than a modern steel scalpel. This image shows an actual prehistoric surgical instrument. The dark obsidian blade is firmly bound to a bone handle, ready to part skin instantly. Once the disc of bone came free, patients didn't throw it away. Across multiple cultures, they kept that piece of their own head, polished it, and strung it on a cord to wear around their neck. Living through brain surgery gave you the ultimate souvenir to show around the fire. You survived the bad spirit, and you survived the surgeon's rock. By modern medical logic, opening a hole in a skull in a muddy camp should result in a fatal infection nearly every single time. The reality flips the entire story. Depending on the region and the skill of the surgeon, survival rates ran somewhere between 50 and 80%. Those are numbers a modern hospital would hang in the lobby. We know exactly who lived and who died because living bone is busy. It repairs and smooths itself over months and years. This is a technical image of a recovered surgical site. Notice the rim of the small circular cut near the back seam. The sharp edges have completely softened, rounded, and healed over. That only happens if the patient goes home and lives for years. A few of these survivors even came back. People got their skull opened, recovered, ran into another bad headache years later, and volunteered to do it again. Look at this skull. We can see several smaller, distinct holes scattered across the top. This is a loyalty card patient. These high survival metrics and repeat customers prove trepanation was a highly trusted medical treatment that delivered real results. None of these isolated tribes had textbooks or teachers in white coats, yet they independently figured out how to safely navigate the human head. If we map out these surgical sites on a diagram of the human skull, a pattern jumps out. They learned to avoid the fatal zones, staying clear of the midline seam and major blood vessels. Instead, they worked exclusively in the safer, off-center territories. Every safe rule refollowed was paid for by the loss of a patient who came before. That brutal lesson got remembered, repeated, and handed down across generations entirely by spoken word. That is empirical science. That is a working anatomical map, built through observation, thousands of years before anyone wrote anything down. If we step back even further, 50,000 years ago, Neanderthals were already running their own sophisticated wellness routines. This image shows the pale bark of the poplar tree, something Neanderthals frequently chewed. It naturally contains salicylic acid, the active ingredient in modern aspirin. They also packed their wounds with anti-inflammatory herbs and consumed early forms of the penicillium mold to fight infection. By scraping fossilized plaque off ancient teeth, researchers found traces of the exact plants shown here. Chamomile, a soothing agent we still reach for today. The archaeological record directly contradicts the idea of our ancestors as helpless brutes stumbling through a foggy world. The next time your head hurts and you take a little pill, remember the brave pioneers who looked at that exact same pain, grabbed a rock, and actually found a way to fix it.